According to a government study, only 28% of people aged 60 or older with poor hearing use hearing aids. This means more than 17 million older Americans who need help are not wearing hearing aids. That could be due to the high costs, the difficulties of seeing and getting fitted by an audiologist, or some other reason. But we hope that the introduction of over-the-counter hearing aids, which could happen as soon as October of 2022, will help more Americans address their hearing loss. In this video, Audiologist Ruth Reisman explains what you need to know about over-the-counter hearing aids, including how they should reduce costs while increasing availability, ease of adoption, and awareness. The doctor explains who will benefit the most from over-the-counter hearing aids, how you can test your own hearing at home, who should still visit an audiologist, and what factors to consider when you're shopping for o.t.c hearing aids. Because I'm in California and she's in New York, I'll be conducting the interview via Zoom. Hi, it's Jeff Hoyt, Editor-in-Chief of SeniorLiving.Org, and today I have the pleasure of speaking with Dr. Ruth Reisman. She's a licensed audiologist and a hearing aid dispenser in the state of New York. Welcome, Doctor.
Thank you, Jeff. Pleasure to be here.
Recent developments, we've got hearing aids that are now going to be available over the counter shortly in the United States. So why is that availability a positive development?
Well, if we look at the research in terms of patients that seek help for their hearing, it really does take about 7 years for them to really actively pursue support for their hearing impairment or for their hearing loss. So I think just the awareness of hearing loss and just that exposure now in the media is really going to get patients curious about what options are available out there to help them. And they may seek out help sooner rather than later, which, as we know, is ultimately going to help improve their quality of life if it does help them improve their hearing.
Wow, 7 years is a long time. So who do you see benefiting the most from the availability of over-the-counter hearing aids?
Well, they are indicated, according to the new release, is that they're going to be indicated for those individuals who have what they perceive to be somewhat of a mild to moderate hearing loss. So they feel that although they can hear well, there are some areas in their life that are really suffering or that they're not hearing as well as they would like. And so they feel that maybe they don't have this huge problem, but there might be a problem. And so that's really the indication here with the over-the-counter option, that they're releasing devices that should be FDA approved or under the FDA guidelines for those individuals that have perceived mild to moderate hearing loss or do have a mild concern in their day-to-day life in terms of their hearing abilities.
So what about people in your profession? Should people still visit with an audiologist?
That's a great question. I do believe that every patient can benefit from some sort of medical evaluation, at the very least, having someone look in the ear, just make sure that there's no red flags or no contraindications to even putting something in the ear or having a device like this inside the ear. But of course, taking that next step and really getting a full baseline of the hearing to understand what level of deficit the patient is at, or the person is at, I should say, the individual is at. And just understand how that can ultimately impact their life and if they are a candidate for these different options. So whether it is a device that's over the counter, or would they benefit from something that's kind of more individualized or more customized to their hearing loss and their acts of daily life and their daily needs.
And then there are people who might be exhibiting some medical issues as well that could be affecting their hearing. In other words, getting a hearing aid would only affect that symptom of hearing loss. But if they were bleeding or had pus from their ears, for example, it's like then they really need a doctor and not just going down to the drugstore for a hearing aid.
Oh, for sure. So that's always the concern, or that is the main concern in terms of audiologists and physicians around the release of this regulation or this device, is that there's potential that these patients will think, okay, I have a mild hearing problem. That is my perceived concern or my perceived disability, and they go and put something in their ear without actually knowing what's going on. Is there something that needs medical attention? Is there fluid in the ear? Is there an infection? Is there blood or pus or something like that being released from the ear? Or is there something even more concerning? So Some of the red flags that we looked at are those things that are obvious, right? Like the blood or the pus, pain, redness of the ear, hot to the touch, those types of things. But one of the main things that we're most concerned about is any asymmetries or any differences between the ears. So if you have, let's say, hearing loss only in one ear, or feel like one ear is mainly problematic, you really want to get evaluated to make sure that there isn't something going on with that ear that needs medical attention. Or if you have ringing in the ear and it's really mainly in one ear, or the ringing sounds different in either ear, that is also considered a red flag that ultimately would need a medical evaluation and attention. So I would agree with you on that, in that regard. Definitely want to take that precaution and take those steps before putting anything in the ear.
Good to know. So if someone without a family history or having any other obvious symptoms just feels like they're not hearing as well as they used to, doesn't want to deal with an audiologist, uh, no insult intended, just wants to go and pick up a over-the-counter hearing aid, what sort of factors should they consider in buying one?
So that's a great question. I think if a patient either, let's say, has been evaluated by a physician already, and they said, you just have traditional hearing loss due to aging or just due to the passing of time, or again, we spoke about the fact that there's reduced access to some people. Not everyone has access to an audiologist or to an ear, nose, and throat physician to get that evaluation. What I would say is, at the very least, maybe do an online hearing screening. So there are multiple ways that you can do this test to at least get an assessment or a baseline of where you're at. Some of them will do tones, and some of them will do speech and tones to understand how you're hearing conversation, how well you're hearing conversation. There is actually one on the Senior Living website that I think works really well. And what that's going to do is screen your level and degree of hearing loss. And that will also indicate or give you an indication as to whether you fall into that category for that over-the-counter device. And then if you decide to pursue that device because you just hit the jackpot and you're in that mild to moderate range, and you feel like this is just something genetic that happens in the family, that over time your hearing decreases, definitely look at the different options that are available before making an immediate purchase or like an impulse purchase. You want to make sure that it is in fact a device that's FDA approved, right? That the guidelines are in place, because they actually recently modified the law or the release of this indication to include or to put a limitation on the maximum output of these devices. So we don't want patients to get a device that maybe is too loud, that potentially can cause further damage, or that is not falling under those regulations that were put in place to ultimately protect the consumer. And then you want to see if there are options in terms of exchanging the device or ultimately returning the device if it doesn't work for you. We don't now want consumers to spend even more money when we're trying to save them on expenses in that regard, especially as it relates to healthcare.
And then the people have different lifestyles. Some people are on the phone or in Zoom meetings like this all day. So I assume a factor will be like, can you connect it up directly to your phone, or are you just taking your hearing aids in and out every time you get a phone call?
I would definitely agree that that's a consideration for sure. You want to take into account not only your degree and configuration of hearing loss and cause of hearing loss, but also what your daily lifestyle is like. And you want to make sure that this device accommodates, if not all environments, at least most environments. So as you said, if you're on the phone most of the days, or your job or lifestyle requires you to be on Zoom meetings often, you don't want to now have a device that you constantly have to take in and out, because there's no flexibility in terms of connectivity and directly streaming to the device, or being able to put a headset over the hearing aid without now hearing whistling or having discomfort in the ear. And what could end up happening there is, if you're constantly taking in and out of the device in and out of your ear, you can cause some irritation, or pushing in the earwax deeper than we would want it to be, causing impaction and those types of side effects or secondary effects that we want to avoid.
So I've heard that a vast majority of people who require hearing aids don't get them. And hopefully, like you said, this makes it more accessible to people who have trouble even getting to an audiologist. But there are some people who just feel like wearing a hearing aid, they don't want the social stigma being seen with one. and it still will cost something. Um, do you feel like, what would you say to them to convince people that over-the-counter hearing aids are worth it?
We have to validate these individuals' feelings, like understand that yes, they may feel that this is an impairment or hearing impairment, and they don't want it to be known, let's say. However, with the advancements of technology, most hearing devices today, and especially those that are going to likely be available over the counter or more accessible to patients, are probably not going to look like our traditional hearing aid that we've known from maybe the 1950s, right? They're going to look more advanced, more sleek. They're going to look more like earbuds, less like hearing aids. So at the very least, if you're going to be using it for those environments where you really need an enhancement or a boost, that it should be something that you don't feel that kind of stigma or feel that negative effect or negative image of having a device in the ear. I mean, these days, I mean, I feel like everyone's wearing something in the ear. My kids themselves each have maybe 6 different types of headsets that one day they're wearing something over the ear, something in the ear, behind the ear. It's just part of today's culture. So hopefully it's more acceptable, and that now if we need that support, it's an acceptable concept, and that everyone kind of wears something in the ear. So it's just more widely available in general.
And have you seen in your patients, like improving someone's hearing and how it can help their health overall?
Oh, for sure. There's definitely, I mean, even in the research and definitely in clinical evidence and seeing all these patients, that we really see a one-to-one correlation in patients that get support and help for their hearing, whether it is something via an online device, an over-the-counter device, or a hearing aid overseen by an audiologist and a healthcare professional. There's no question that it does help to improve their quality of life, in that they now want to be more active and they're able to participate in conversations more with family, with friends. They want to be more social. They now have this kind of renewed sense of life and this reason to go out every day and pursue new opportunities and pursue opportunities to communicate or to listen to a lecture or go out to the theater or go to the museum, whatever really kind of tickles their fancy, I guess. But we definitely see that correlation. And there are assessments or questionnaires that sometimes we can do before they get their hearing device to see where is their level of concern before getting any help, and then have them answer those same questions after getting help and see if there is an improvement, in fact, in their quality of life. And most of the time, like I said, there's almost a direct one-to-one correlation where not only are their social interactions helping, but because their social interactions are improving, their health overall improves as well.
Great. Well, really appreciate you taking the time and spreading the gospel of over-the-counter hearing aids. And hopefully we'll be helping the health of millions of people after this becomes part of the law of the land. So really appreciate your help. Thank you, doctor.
Thank you so much for the opportunity. And I think it's a beautiful thing. We should be able to help more people and penetrate that market more. And then hopefully it'll get people starting on their journey with hearing help sooner, sooner rather than later. And then hopefully improving their quality of life as the positive side effect.